This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Gabapent M Tablet is an effective solution for nerve pain management. Its unique formulation combines gabapentin and methylcobalamin. Indications and uses. This medication is primarily indicated for the management of neuropathic pain, which can arise from various conditions such as diabetes or nerve damage. It serves to alleviate pain sensations and enhance nerve health through its active ingredients, which collectively work to reduce pain and support nerve regeneration. How it works. Gabapent M Tablet functions by blocking pain signals in the brain while promoting nerve repair, thereby reducing pain sensations effectively. Directions for use. The medication should be taken as prescribed by a healthcare professional. It is important to swallow the tablet whole with a glass of water, without crushing or chewing it. It can be consumed with or without meals. The prescribed dosage will vary based on individual health conditions, and it is crucial not to discontinue use abruptly without medical advice. Possible side effects. Possible side effects may include dizziness, drowsiness, nausea, and mood changes. It is important to monitor any unusual symptoms and consult a healthcare provider if they occur. Precautions and warnings. Before initiating treatment, it is critical to discuss any pre-existing medical conditions with a healthcare provider. Special caution is advised for individuals with kidney or liver issues, or those who are pregnant or breastfeeding, as well as those with a history of substance abuse. FAQs. 1. How long will it take to feel the effects? It may take 2 to 4 weeks for pain relief to become noticeable. 2. Can this medication be taken with alcohol? No, it is advised to avoid alcohol as it can increase drowsiness. 3. What should I do if I miss a dose? Take it as soon as you remember, but skip if it's close to the next dose. 4. Is it safe for long-term use? Safety varies by individual. Regular monitoring by a healthcare provider is recommended. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below.